As Dr. Delecea said, DAO deficiency is something that has always been thrilling. It answered a question that has to do with me daily clinic. In my daily clinic, I see patients with ADHD. I sometimes make comments or jokes with my colleagues that are working with allergy that sometimes it looks more like an allergology practice. We were doing a study on this. 50% of my patients had some kind of atopic pathology. And when we saw the levels of immunoglobulin, they are below 300 in basal figures. So I still joke with this, but these are objective data. These relations, when we have Carlos Delecea and the rest of the team with DAO, it starts to answer a series of hypotheses. I'd like to point out a few data for the audience. ADHD is the most frequent neurodevelopment pathology in infants and adolescents. 4 to 8% of the population and of children and adolescents in the world have this pathology, and 2.5% approximately will have symptoms in their adult life. We have a multimodal type of treatment with medication, psychoeducation, sport, psychotherapy. Sometimes ADHD is wrongly considered as a mild pathology. However, it is a pathology that, if it is not treated, will have plenty of consequences and a very clear impact. I'm just going to give you a couple of articles that show this. When I ask what's the pathology that affects the subjects of this problem, some say schizophrenia, bipolar disorders. Some say. But in this article, it was proved that it's ADHD. What people do not know is that if this pathology is not treated, the mortality rate enhances a lot. 1 out of 3 traffic accidents are involving people with ADHD. This is one of the articles that I have gone through more frequently because it is an article, a wonderful article from Sweden with more than 700,000 people. The graphic may seem complex, but I'm going to interpret it so that you see the relevance. In Spain, we say that birds of a feather flock together. Here we see male ADHD and female ADHD. The question in this article is, what the authors wonder, is whether people became partners if they had the same type of pathologies from the psychiatric point of view. And the answer is yes. And do they normally go an anorexic person with an anorexic person, and obsessive compulsive disorder with another one, etc., or what? So they found that men with ADHD, they had 10 times more likelihood of getting a partner with autism or Asperger patients, and then with ADHD as well. And in women, the same. There is something in ADHD that makes them become partners. And this is what I see every day. The most interesting thing here is this study of mortality in Sweden, published by the epidemiologist team, in Sweden, and they proved that children, adolescents, and adults with ADHD, when they were not adequately treated, mortality was 2 to 8 times multiplied. So you can see the tremendous repercussion of this. And when it was treated, mortality became normal. So when Carlos or the rest of the team asks me about the relationship between ADHD and DEO, I carried out searches, and nothing was found regarding histamine intolerance and DAO deficit. But researchers should not be discouraged, and you have to start opening doors, and you realize that there is plenty of literature between the relation of ADHD and neurotransmission. The slides that make reference to histamine intolerance, you can see that there is a clear interest for DAO and histamine intolerance. I would like to highlight something. This is something that I didn't know. There is a big amount of drugs that are quite frequently described by any kind of doctor that lower the efficiency of DAO. So between histamine intolerance, DAO deficit, we may have a genetic DAO, or we may be looking at phenocopies with people that do not have this deficiency, but due to exogenous things such as physical exercise, alcohol, NSAID, other drugs that lower DAO, a lot of food rich in histamine, tomatoes, bananas, etc. We're going to have phenocopies of these patients with normally a deficiency, a genetic deficiency. We have possible symptomatologies. Our colleagues have mentioned it. Just as in the case of migraines, this is something that we are systematically analyzing, and this could be improved with external supplements of DAO. So we come back to ADHD. ADHD is not only pathology with plenty of comorbidity from the psychiatric perspective, but it has other problems. This is an article that we're going to replicate soon. This led to the study that I mentioned earlier, and these authors found something that was coherent with my everyday experience. Most of children have symptomatologies like asthma, allergic rhinitis, food intolerance, etc. And they found levels of IgE that were very high. These levels are similar to what we see, 300, 350 in immunoglobulin, basal immunoglobulin. And we're speaking about children with ADHD. I'm not saying that they are allergic and patients and that's it. There's plenty of relevance, and we have to think about the role of histamine, and we have to take into consideration at least 3 factors. On the one hand, we need histamine at the body level. We have histamine and this enzyme in the brain that degrades at the brain level histamine. And we have IgE. And we have to remind you that IgE does not penetrate the hematoencephalic barrier. So I suspect that there is balance, an unstable balance between body histamine and brain histamine. This is a topic that has not been studied, and in this balance, DAO is going to be critical. When we speak about ADHD, we speak about the main element for neurodevelopment, but alteration of autistic spectrum is also very important. Comorbidity with tics that could be connected to deficiency. There are animal models that are based on the enhancement of the prevalence of autistic spectrum disorder, and apparently these pathways are critical regarding the modulation of this particular case. This is another study, in my opinion, probably a too deterministic study. The use of antihistamine drugs in the first few years could be the increase of ADHD. I don't think this is the case. It is not a causal relationship. Those children that had antihistamine treatment because they had pathologies that were related with rhinitis and atopic skin, etc. And this is related to what ADHD means. Colleagues have spoken about histamine, and all of us, or people that may have had to use antihistamine for allergic problems, know that those that go through the barrier were sedating us, but the studies say that did not alter the process of memory. How do we link all this? ADHD, IgE, DAO, etc. This is only a hypothesis, but what may happen is that there is a genetic association between the atopic pathologies and ADHD, because probably it has some developmental sense. And this IgE that is activating mastocytes is going to free an important level of histamine, and this may bring about allergic reactions, and probably it will change the disbalance at a cerebral level. Another important thing is the neuroinflammation as well. As Dr. Sammauro said earlier, the relationship between histamine and pain, and not only pain, but also inflammatory mechanisms is important. This article proposed that histamine could be the lost chain, the lost part of the chain in this regard, in depression. Histamine could be the lost chain between the associations of the ADHD and allergic pathologies, whether they have a mechanism that is guided by IgE. I'm just showing some data from this study that I mentioned at the beginning, when we found, this has not been published yet, but approximately 50% of our patients showed atopic pathology, and more than 25% of them had low levels beyond 300 in IgE. As Dr. Delecea said, we are going to start soon a preliminary study that is a very interesting one. First, to define the prevalence of the DAO deficiency in the regulators of DAO deficiency, and I suspect that we're going to find very high levels. In our study, 87% of patients with migraine had this deficiency, but this has to force us reflect upon that. What is the developmental sense? What is the role of DAO? What has its role been as a species, as a human species? What is the mechanism and why such an enormous percentage of the population has this deficiency? I think I skipped the last one. I want to make reference to a book that I published recently, Checkmate to ADHD, and I speak about IgE, not the DAO deficiency, but probably in the second edition I will make reference to it. Thank you.